All right, everyone, thanks for joining in with us today. As Susie said, it's the first one, and it's really just a generic overview, bit of signposting and useful information areas that you can consult with, and really how we've got to where we're at. So, as Susie said, my name's Andrew Pearson. I'm Environmental Health Officer in the Environmental Health Protection Development Service at Ards North Down Borough Council, and I'm representing our whole team, and there's 6 of us there in health and safety at the minute. So really, the whole team will deal with queries, and we all have different sort of areas of expertise and experiences. So basically, the first message I want you to take away is don't hesitate to get in touch. If you do have any queries at any stage, just get in touch with us, and we'll be able to assist you. The aim of the presentation then this morning is to provide you with a generic health and safety advice on your business, how you can effectively respond to this hazard of COVID-19 within the workplace. So in order to do that, we just want to identify the 2 main pieces of legislation that we're working off. How then you can go ahead to plan to reopen, and even if you've already reopened, that process can still continue. How you go about doing your risk assessments, why and how would you train your staff in reaction to such risk assessments, a little bit about your customers in COVID-19 and their duty and their customer service and all this, a little bit then about the enforcement of how we go about enforcing these things, and then obviously the questions. All right. So starting off then, we have the 2, this actually, there was a question, a pre-submitted question regarding legislation, and where do we find legislation and updates. So whenever you get a copy of this assignment or this presentation, these links are live, so you'll be able to click on the links and it will take you to the government websites where the legislation sits. Now, just under the title there, it says links to legislation may not contain all amendments. There's a bit of a time lag at the minute, and the reason for that is, and that obviously applies really to the new piece, the first one there, the health protection coronavirus restrictions regulations. There's a time lag. Whenever legislation's made, it's usually drafted and issues are ironed out and we have time to reflect. It goes out for consultation, it comes back, amendments are made. It's usually a very long drawn out process. This has been a very fast process, and the amendments take time to be edited back into the legislation. So as we've had easings in the legislation, the actual legislation still hasn't maybe been updated, although the executive has announced the changes are now permitted. So it takes a little bit of time for the amendments to catch up. So just be wary of that. When you read the legislation, you just need to make sure that you're reading a consolidated or the most up-to-date consolidated version. Now on the website, you'll find at the end of those links, you'll find all the amendments also. So it's just to make sure that you're running on up-to-date information. So a little bit more about the health protection coronavirus restrictions regulations. So they came into force there on the 28th of March 2020. No draft, as I said. And they were, as you all know, they were made in response to this imminent threat to public health, and that's why there was a rush. It was an imminent threat to public health. So basically for us, the specific parts of the legislation, or 3 and 4, they contain direct instructions on businesses, and they require certain businesses to close during the emergency. Or some businesses may be allowed to open, but there may have been restrictions placed on those businesses, as I'm sure you're all aware of. This was policed initially only by the PSNI, and then local government enforcement followed that. And it's just some of these restrictions obviously are still in place for certain businesses, and some of these things have already been announced. So again, it's just about knowing what piece of law applies to the closing of business, that's the coronavirus restrictions. And that permits who can open and who can close. And just at the bottom there, just to demonstrate the strength of this legislation, it laid down the requirement for people to stay at home. You know, that's how powerful that this was, and it still is, you know, because don't forget, we don't know what's ahead. Future restrictions may kick in again. If it could be regionally, it could be nationally, we just don't know. Hopefully that won't happen. The other piece of legislation then is the Health and Safety at Work Order NI 1978. This is your workplace legislation that you should all be familiar with, and I'm sure you all are. And you know, the next point, nothing new here, because there really isn't anything new here. The only thing new about this is there's a new hazard has come along, and it's coronavirus. And it's the exact same requirement to carry out a risk assessment, and that duty is on the employers, and it's also on the employees to react in the correct manner to the risk assessment. So essentially then, you've got the Health and Safety at Work Order, which is your workplace long-standing legislation. That's how environmental health, police, when the business is then open, are you running the business in a safe manner and not putting anybody at any unnecessary risk or any risk? And then the coronavirus regs is the piece of legislation that environmental health will use to request you to close your business should you not be permitted. And you have all the very strong public health legislation involved in that, which is specific to coronavirus. And it has the coronavirus legislation has a shelf life of 6 months. So it's yet to be seen how that's going to change in September when it times out. It could just be simply extended, or it could be completely updated. We don't know. One pertinent point about legislation is when you listen to the executives or the Downing Street, at the start it was really more Downing Street, and then it turned in more executive. When you listen to those announcements, that is the first time that local government or environmental health departments hear about easings and things. We don't get any head start on legislation as far as this is concerned. That I'd say there hasn't been a consultation or anything, so that wouldn't be normal, but it's just a demonstration of the times we're in at the minute. So once you get your, now that you know obviously what you're bound by, and so some business is already open, but don't worry about that, because there's always, you must reflect anyway. So we'll just take this as a when you are opening. The first thing that we feel is the best thing to do prior to opening would be visit our website, and on this presentation, which you're going to get, you've got the link there, and it'll take you straight to the health and safety pages of our website. And there's lots of great documents there, easy to read, and they're very straightforward to the point. What have you got to do? And really, it's all about starting your risk assessment. And over the past few months, when the team's been talking to businesses about coronavirus and reopening your business, lots of people, they're unsure of how to go about the risk assessment process. And this is why we've really launched this little webinar, was to get you started and give you the information to go off and get that process started. And even if you're open and you haven't done it, there's no problem. You can go ahead and do it now anyway. So go onto the website, and it's in a further slide, but there's really good documents there about how to carry out a risk assessment. And we've actually got a generic risk assessment there for you, and it relates to COVID-19. So it explains all that, and it gives you all the information how to do it, which we'll go through in a little minute anyway. But it's just important logical steps here. Go and look at that first. That would be your number one reaction to this would be go onto our website with that link and take a look at the documents. Then attempt to carry out your risk assessment. Then you're going to ask yourself, when, okay, maybe you're open, but if you're not, when am I going to open? Because there's still uncertainty. And the quick answer to that is when the legislation permits. Because if you open when you're not supposed to, you're actually working against the coronavirus regs, against the law, okay? Then how are you going to prepare then when you're going into this new work environment? Because it is a new work environment, there's a new threat. What way, what's changed, what controls are you going to have to put in place? And this is all determined by your risk assessment, and we'll go into that in a minute. You will have new procedures and reopening checklists. It's all on the website there at that link. So if you've got possibly going into a dormant building, there could be stagnant water tanks, lots of things like that that maybe you haven't actually thought of. There's building reopening checklists. There's getting back to work. There's hygiene checklists, and there is toilet checklists. Lots of different things there. And if you have any problem finding anything, drop us a line and we'll send it out to you. I'll give you details later on how best contact us. So then, obviously then, as I just said, you can seek advice from ourselves, the gov.uk website, the Northern Ireland Executive website, and obviously then the legislation itself. You've got all sorts of other resources there, like your industry bodies. Tourism NI, I believe, are very good there for the hospitality sector. Obviously then, as you would always do, check out your competitors. What are they doing? Have they made positive changes? Have they made negative changes? And maybe you don't want to follow what they're doing, but it's always good to have a look. And I'm sure you do this for other things anyway, so why not health and safety? Obviously then, as the timelines go on, we may be faced with further changes in legislation. They may be positive. They may be slightly back then to previous steps in this unlocking. So it's always and it is fluid, and it's very, very dynamic. So always keep an eye on that. Obviously, it goes without saying. Be aware about bogus information. I mean, over the months, I've had so many people saying such and such said and this said, and frankly, a lot of it can be wrong. So it's your duty then to take your own action, and you're responsible for it. So don't worry about what anybody else. Come to your own decisions and get the informed information first. I mean, this is not made any easier by the confusing four-way UK approach, and if you add in then the Republic of Ireland as well, essentially we're hearing all these things. You can do X, Y, and Z here or there. What can we do? So it's not easy, and it's not easy for anybody from that point of view. It certainly adds to the challenge. So, but we always work through it with you and get there in the end. Changes are inevitable in all workplaces. I put that in there because if you walk back into your workplace and you haven't changed anything, I would be very worried about that. I don't think there's any business in our borough could actually do that without making some sort of change to the new workplace. Just with the nature of this issue that we're experiencing at the minute, as we all know from just going out and about to do our weekly shop, there's changes are inevitable. If you haven't changed anything and you don't feel you find any reason, please get in touch. Again then, so these documents that we've linked you to are all live and they should update, but just maybe even if you've got any doubt, check with us then before you go ahead with anything, if there's any ambiguity around anything. So just for your sort of handiness, we'll give you this page of links. The first one is the one that I'm talking about. You should go to first. That's our own advice centre. And then you've got various other ones. A good one here is this one, which is the timeline for NI businesses reopening. I mean, most businesses may be open now, but there's still a lot that aren't. There's still a lot that they're not permitted to open. So keep an eye on this for your updates, because this is a government website and it comes from the executive. And there's good resources on the gov.co.uk one if you want signage and things like that, okay? So risk assessment of COVID-19. What is a risk assessment? A risk assessment, the official steps are, there's 5 steps to risk assessment. Identify the hazards, number 1. Number 2, decide who might be harmed. Number 3, evaluate the risks. Number 4, record your findings and implement them. And step 5, review your assessment and update if necessary. Now, all those 5 steps take place inside these bullet points here. Who's going to carry it out? Most likely yourself, but you can appoint a competent person. That could be someone within your own workplace. That could be a manager, a health and safety representative, consultant that you brought in. If you follow these links, these take you to the HSE website, and that's good risk assessment advice in there. Basically, you can do it yourself, but if you feel you're not competent, then get a competent person to help you or do it for you. All right. Again, I'm going to show you a snapshot of this, but I'll just keep reminding you there is a COVID-19 generic template available on our website, and you're now going to have the links. So it's a 5-step process, and on the previous slides we said you're going to have to do this first before you really reopen. And why do you need to do it? Because if you've ran out and bought a load of stuff to make your business safe and you haven't actually risk assessed, how do you know what you really need? I'm sure you've gone into business that, oh, they have screens, they have hand gel, they don't, they have, their risk assessment has determined that. So this is the page then, when you go onto the website, you'll find the link to the generic risk assessment. And this is just the first page about hand washing, okay? And it's really just to walk you through. So what's the hazard? COVID-19. That column does not change the whole way down. The next column, who might it harm? Basically, you could just write everyone that comes into contact with your business. But there's lots of different people. If you think about it, you've got delivery drivers, contractors, cleaners, staff, visitors, customers, everyone, okay? And then, so that's who might be harmed. And then you're evaluating the risks here, and what's the controls? Well, how do we prevent it? We wash hands. We dry hands, and then we've actually gone ahead and provided these are all live links on the other templates. So, and this document just flows down with lots of other examples. So you can then, it's a Word document. You can file, save as, delete what doesn't apply to you. Obviously, hand washing will apply to everyone, but delete on further on down. You'll understand that when you see it later. The things that maybe don't apply, and add in the ones that we haven't got that really only apply to you, and then just follow the same process. And then additional controls. So then we're going to put down, this is your bit obviously, who is going to action this? So this could be a responsible person, or if in the case of hand washing and paper towels and things, it could be someone maybe that deals with cleaning of the toilets or something like that, to make sure that all the things are in place that you've outlined. When are you going to have this done by, and whether or not that's actually been done, okay? So that's a real quick, simple, there's lots of other templates out there, and if you may have your own system that you prefer, but this is ideal for someone that maybe isn't quite so sure. Follow the links and find the document and try it out yourself. Go around with the piece of paper and simply go through your business and say, well, we've got contact surfaces right, we're going to have to increase the cleaning, etc., etc. So once you've carried out the risk assessment process, you've then got a legal duty then to train the risk assessment process falls under the management of health and safety regulations, and also then you've also got a similar duty then to train your staff, okay? So you must train your staff. You've risk assessed. You must adequately train staff on those risks, okay? And that's really important at the minute, because the workplace has changed or is changing, and they may be walking into an alien-looking workplace where there's a lot of new things that must be done, and they may not have had any experience in setting it up, or it could be their first day back after a long furlough period off, so they might not know what's been going on. They may have been sick to COVID-19, lots of varieties of what could have happened. But you've got to train them up, and you've got to record that. Now, the best way to train them up is go back to your risk assessment and get them to read it. And maybe then ask them a few questions to prove they've understood it, and then make a record of the training. It could be a simple list. and you can use lots of other options. Simple team talks, tea room talks, toolbox talks, WhatsApp groups, Facebook chats, whatever you want. It's up to you. But you've got to record it so you can demonstrate at a later stage. Well, we did train, this is how we did it, and these are the materials we used. And while you're going through those steps, you're achieving all the you're achieving a lot of the goals that your health and safety enforcement officers expecting you to provide for your staff in your workplace anyway. So if we forget about COVID-19 for a minute and just look at all hazards in the workplace, it's exactly the same process. So you can continue your document and move on then to manual handling, transport in the workplace, you know, things like that. So once you get in, this is why we felt there was good value in providing these links and this bit of information. Once you start this process, it's got to remain live, and you've got to keep going with it and continue the process through the operations that are specific to you in your workplace, okay? And by all means, if you have any issues or any specific operations thinking, oh, I don't really know how to go about this, give us a shout and we'll help you out. We'll come out, we'll do it online, whatever. But basically, the other opportunities here, this also provides better standards of customer service. It enhances the customer experience. If you go out, and I've been in premises myself, where you've arrived at premises and the staff on the ground don't really know what you know, where do you go or what's the process here, and I'm sure you've all experienced this yourself. So in my opinion, that's poor customer service. You know, you're just left to fend for yourself maybe, and that's not how it should be. And as a customer, you're not really feeling very valued, and you know, your safety hasn't really been made a priority, and I think it shows. So it can also increase staff morale because it gives the staff a better feeling of value. They feel that a bit of time to be invested in their safety as well, you know, right across the board, COVID-19 or not. And also confirms then to the duty holder that staff understand what you're asking them to do, because you may have spent a lot of time getting safety up and running, and then you leave it to the staff, and then because they're maybe poorly trained or they haven't had adequate risk assessment and they don't really know what to do still, but in your head you know what you want them to do. So it confirms them with you, right? They know how I want this place to work when maybe I'm not around, you know. So your customers then, and COVID-19. Of course, everybody has this moral duty to follow public health guidance relating to the prevention of COVID-19. In fact, in some cases, there's also a legal duty there under the coronavirus restrictions regulations. But employers do have a requirement to guide the employees and all the visitors in a controlled way. It's not a free-for-all. So how do we go about best doing this? And the first question is, you know, with the nature of COVID-19, the best thing about COVID-19, there's not many, but the best thing is it can't spread itself, but it relies on humans to do that. So if we distance, we prevent the spread, okay? So the first thing is, what can I do at distance? Can I use digital services rather than face-to-face, either sales, meetings, whatever? Can I encourage delivery, click and collect, mail order, collection services? You may be able to collect something, offer your service and then return it, like say for example car repairs, contactless and cash payments, etc. So at every opportunity you're breaking down the chance to get close. Then if your customers are coming to the premises, you can influence them before they even arrive, and a lot of you probably have already done this. You can communicate to them, you can send them pre-visiting information on what restrictions or new procedures there are in place. Tell them things like, when they arrive, where do you expect them to queue? What entrance or exit do you expect them to use? Inform them of new one-way systems, new entrance and exits, hand sanitizing, cleaning stations, screens. You may have a completely different ordering procedure. People have desks at doors, things like that. what PPE maybe they be required to use. What PPE will you be using? Obviously, we would expect to see signage at a business. So if you're getting a lot of walk-in trade and you don't get the opportunity to speak to them, you're obviously going to have to sign to them. So clear instructions on visitors. What is the procedure on site? And this is you starting to control them safely. So please queue up to the left or the right, or follow the footprints, or follow the 2 meter, 1 meter spacings, whatever it is you've got off the back of your risk assessment. Communicate that out to your visitors. And obviously then visitors displaying symptoms of COVID-19 should not enter the premises or use the services. There was a question came in, it was a good opportunity to raise it now, is the need to screen for visitors. And some businesses that will be suitable and very useful. There's no legal obligation to do that, it's just very good guidance. But yes, we would encourage that. Where you feel fit, certainly that should be as part of your controls and your risk assessment, and then anyone displaying symptoms should be discouraged for coming, or don't come along. So moving on to enforcement, primarily the message is we're happy to help and offer advice. So environmental health is a service from the council, and if you have any queries, get in touch. And this is how there's a COVID-19 inquiries at ardsandnorthdown.gov.uk email address. And I would urge you, if you have any question, no matter big or small, about COVID-19 related inquiries to do with your workplace, that is the email address that you should send it to. And the reason I would encourage that is, for example, I'm going off on leave in a couple of weeks, or next week for 2 weeks, and I won't be able to answer questions from my personal email. But this email address is manned by the whole team, managers and everything. So I would encourage anyone to put their queries in there to ensure they're opened up to the team for everybody to consult on, and someone will get back to you then. We have a response time of about 3 working days. And obviously times are busy at the minute, but we will always get back to you. If it goes into that email address, we will log the service request on our software, and then we'll get back to you. So that would be the best way to get in touch there. So obviously then, as we've gone through this pandemic in Northern Ireland, the PSNI and local authorities now also have then the enforcement powers for the Health Protection Coronavirus Restrictions Regulations NI 2020. And a memorandum of understanding is in place for what authority responds to what inquiries. So the PSNI will take a licensed premises, for example, they will deal with the licensed premises being open. And at the minute, the law dictates that alcohol could only be purchased as an ancillary to a substantial meal. However, then, if there was issues in that workplace, in that business with hygiene or social distancing to do with coronavirus, then the health and safety team will get involved. And they will do it from a workplace health and safety point of view. The PSNI will be working there on the licensed coronavirus restrictions regs, okay? So there can be a bit of a crossover. And also, obviously, then, as Susie said at the beginning, there's an equal divide between the Health and Safety Executive NI and local authorities. There's a piece of legislation called the Health and Safety Enforcing Authority Regulations 1998 that determines which authority, be it local government or the HSENI, has authority over which businesses, and they're clearly outlined who's responsible for who. So if we get inquiries about businesses that don't fall under our jurisdiction, we'll refer you on to the appropriate authority, okay? So ultimately then, Ards and North Down Borough Council has a duty to enforce the legislation, and we do have a graduated enforcement policy. So in order to achieve compliance, we use many forms of enforcement tools, from advice warning letters, fixed penalties, prohibition notices, improvement notices, right up to prosecutions. Hopefully we don't ever get to the latter ones, but sometimes we do. And then it's really important just to highlight that all the other legislative requirements are still intact regardless of this new piece of legislation brought about by COVID-19. If we take Pavement Cafe as an example, if someone wants to put an awning up for tables and chairs to put outside their business, there's still statutory legislation there regarding planning and pavement cafes. So you may have already satisfied those, but if you haven't, you still need to. And there's no relaxations as such, because we can't relax. There has to be legislation, must be legislated away. It can't just be relaxed. It's either a crime or it's not, if want for a better expression. And that is really it. I know that is a fast tour, but really we hope that that's answered the questions that people may have had about how to start the process, because that's the first hurdle. I'm just seeing the questions now because we're sharing my screen. You have just, sorry, yeah, that's a really good one there. You've just used the expression generic risk assessment. Can you confirm that you have multiple? So there's different types. Whenever I say generic risk assessment, the example we have given you is a generic. In other words, it's not specific to any business. You've got to make that generic document, would be a better way of describing it. You've got to make it specific to your site. Then it becomes a site-specific risk assessment. So that was Gary. That was a good question, because although, yeah, once you take that generic document and you put it through the process, it's now turned into a specific risk assessment. So everybody would end up with the same result. Does that answer your question?
Sorry, Andrew, I'm aware that went in a private message to you, so I can't even see it. So you might want to just reiterate. Okay. I'm assuming what the question was is, yes, can anybody use that generic risk? And your answer is yes, technically, but it's only the basis. You need to personalize it for your own business and then save it. And once you've done that, then it is your personal risk assessment. It's just a template that's been provided, but bits of it will apply and bits of it won't. That's right. So yes, it's better. I mean, we're going a wee bit deep into that, and that would be pitched at someone that's more afraid with risk assessment, to be honest. But it's a really good point. It's better to call it a generic risk assessment document. Then it'll end up being what we would call a site-specific risk assessment. So that will be specific to your business and your site. And if you have multiple sites, you'll need to run the risk assessment to suit each site. And that's why it's specific to that site, okay? So. And Andrew, I'm assuming for those that don't have specific sites but have a service, they need to run it for the service. And if the service is the same in different locations, it only needs one per service. But if the service differs in different locations, you would need specific to the site and the service, would you? Well, that's a really good question, Susie. And yes, it's something we've came across. So some people visit different sites. If you take, for example, let's just say a hairdresser, that their business is going into maybe nursing homes or vulnerable groups, and then maybe a youth club. Say they do a nursing home on a Monday, the youth club on a Tuesday, and maybe they visit someone else's shop then Wednesday, Thursday, Friday. They need three risk assessments, one for each site. So they do. So although the service is the same, you're going to have to then do risk assessments for each site, and on them you may then have differing services that you do on different sites as well. So I think, Gary, do you want to come in there? Or do I hear?
I suppose my question is more on the lines that if you're doing the same actions at each location,
yes,
because we know we have to wash hands. We know we have to provide different things, okay? The rest of your business is already risk assessed on all your other areas, okay? If you're carrying out the same actions that you're being asked to do by the government guidelines, then why can the risk assessment not be the same? Because you shouldn't be doing anything different.
It can be the same. It can be the same, but the problem is when you go from site to site, the environment changes. And really, it actually then just depends on what you're doing, Gary. But if nothing changes in what you're doing, then yes, it's completely transferable.
Okay, thanks.
But for some issues arise when maybe different layouts, you might in one premises, for example, hold customers in a waiting area, and maybe that waiting area doesn't exist in premises two. You still need to risk assess the waiting area. There could be magazines there that you don't want provided anymore because everyone will be touching them, etc. So that things like that, it's only really then regarding the building and the environment of the building. But if what you're doing doesn't change, it's completely transferable.
Okay, hopefully that's answered the question. I don't see any others coming through, but Andrew, you had a couple that were pre-put in. So there's a few more around that, which you sort of did touch on, but are pre-visit questionnaires required? So that would be for customers or visitors coming in to your site or using your service. And similar to that, there was a question about, do returning staff need to complete a questionnaire? So I suppose maybe if you talked about, questionnaires, whether that's either via your staff or your customers using your business or service. So you sort of touched on it, but you might want to just reiterate.
Yeah, basically then the screening of people coming back from sickness, things like food businesses, that's always been a requirement, but tying that up with people coming to your business as well, it's really, if you feel that any of that could be any way appropriate, yes, you should be doing it, and the guidance would be, yes, do that. For those coming back, yes, document it, because what you're actually documenting there is you want to document the maybe quarantine for the right amount of time, things like that. So yes, you do need to record that. How else would you demonstrate you've actually done it otherwise? And you don't have to do it for your customers. There's no legal requirement to do that for sort of open custom. Things like restaurants though are doing it inadvertently because they'll have a name and a number and they can contact out then need be anyway, but they're not necessarily getting any data on if they've been sick. But especially if some businesses are calling out to houses, providing a service, say you're going out to fit curtains or blinds or something, you need to be, the guidance says you should be ringing ahead and screening who you're going to. So you're going to your customer, you need to screen. But it gives you it obviously gives you the information you need to assess whether or not they're sick. And if they're sick, they shouldn't be there.
Okay. Andrew, we have a couple have come through just in the Zoom chat. So the first question is, what do we do when customers deliberately ignore signage and advice? And I suppose specifically that's from Sandy Knows, so the caravan holiday home. So how do I mean, I think that's going to be a big challenge, particularly when you've got lots of visitors coming from all over the place. So
exactly, and look, I have it on one of my slides. The public have a duty here. What do you do? That's a great question. If you're content that you've done all you can, you've done nothing wrong. That's down to an individual. What can you do? People have a duty themselves. The government has been clear on that. We're in this together. There's always going to be that group of people, unfortunately. I think you can't control what other people can do, but you can control what you do. And I think you should, if that became a prolonged issue, you could consult with the police, because it could then become a public order issue. It doesn't fall under the health and safety if you've done what you can do. That's to protect you as the business owner.
and to protect your staff and customers. You've done that. You've got to content yourself and make sure it's their duty, really, is the answer to that one.
So, Andrew, there is a couple of other questions, but just on a follow-up to the
Yeah.
Santico question, yes. So are you allowed to ask somebody to leave? So, you know, if you're controlling your own business, whether it be a holiday home park or a shop or a whatever, if they fail to continue to comply with what you've asked them to do as the owner of that business, I know that would be difficult, but I suppose the question is, do you have the right to ask somebody to leave your premises?
Well, that goes back down, really, you know, if you do your risk assessment and you identify the controls, let's just say then someone's not following my instruction. The control could be to warn them, and then maybe your policy will be, if you continue to ignore my advice, you will be asked to leave. And that'll be your workplace policy, which you're entitled then to provide to your customers. So I would be thinking of that route where, and I would also refer you straight to Julianne or Karen, who deal with caravan parks from a health and safety point of view, and get their take on that. But if you can put it in your policy that if they do continue to ignore sound government advice and sound company policy, that it is your procedure to warn them and then remove them, that's fine. And you know, you could maybe speak to the police about that. Does that help? I would go to Julianne and Karen with that. If you don't have their details, let us know and we'll get you in touch with them.
Well, there was also another question from another business as well there, and that's more about soft children's play areas. So I'm assuming it's the same thing, that if any business, no matter what type, that if your customers are continuing to refuse. So what you're basically saying, Andrew, that yes, write into your policy from a good customer practice, they'll make it quite clear, put a big sign up that if you do not follow, you will be asked to leave the premises.
Exactly. So again, we'll use that example. If your customers arrive and maybe maybe you've written to them all, and now there's a sign and you've communicated to them, this is our policy and this is how we're doing it, and we've risk assessed, and even if they want to have a look, this is the action we'll take. It's up to you how you take those decisions, you know. But I think that from a customer service point of view, you want to tell them the rules first, as you would do anyway with other issues, and then, you know, you probably already have a policy like that anyway. Just make it fit COVID-19 and social distancing.
Martina had another question as well there, Andrew. So, I mean, you probably know, runs the Happy Town in Ards there. So, what the question is more about the children's. I don't know whether you'll be able to answer this one.
I don't know.
So the question is, just for the recording, are children still included in the 1 meter distance as yes you run? I think that's going to be really, really difficult.
I mean, that's difficult. Of course it's difficult. But yes, I mean, there's no differential between who's allowed and who's not. A person's a person. Of course you're in a position to ask someone to leave your premises. You have a duty to do that under health and safety. If they're not fulfilling it, you would be irresponsible allowing them to continue to ignore. So it's your duty to do that, and so you can use that for your benefit, you know, as offering a safe service. That's to all your customers' benefit. Unfortunately, if they don't adhere to your advice or your policy, you can ask them to leave. Of course you can, yeah.
And so just to answer that first question, I know, Andrew, you said you were struggling with it, but the 1 meter rule is still technically there. So
it is still technically there. Basically, you need to go to your risk assessment though, and basically you need to end up then at a 1 meter rule by providing other mitigating controls. So you know, you can't just say, well, we're going to the 1 meter rule. You've got to introduce other controls to then allow that. And that is how in the legislation that it's firstly where 2 meters can't be observed, because the more distance the better, and that's the bottom line. And then where it can't be, if you introduce further mitigations, then you could reduce it to 1 meter. So you need to do your risk assessment and get to the 1 meter by bringing in controls, and then you could have the 1 meter in that situation.
Good, yeah. I don't know how you do that for a soft
again,
children's play area
again
unless you
with,
restrict them per family zones or something. But maybe we
well,
could pick that conversation and try and help offline with
yeah,
you.
that's, well, we can look into that for you, no problem. If you send an email into that email address, we'll pick it up, no problem, okay?
The other question there then that has come in as well, Andrew, is if you've got a guest coming in to a holiday home,
Yeah.
how much time do you need to leave in between? So they normally leave at 10 and then in at 4. I assume the answer there is more just around how long will it take you to make sure that it's adequately cleaned as opposed to...
Exactly, yeah. I would definitely advise you to go to the Tourism NI guidance. You'll find it online. But basically, again, everywhere's different. And it depends on even down to the interiors of the rooms and the homes, whatever. But you've got to do your risk assessment on your cleaning and how you're going to sanitize it, and you'll come then to a safe decision on how long that should be, because it'll depend on your cleaning process, and it could be quite quick depending on what actions you take, or it could be a long process if you want time to do the work rather than maybe chemical cleaners and things like that. So you've got to do your assessment, but there is guidance out there. So I would urge you to do a Google search for the Tourism NI guidance on that, or Hospitality NI as well.
Yeah, there's a link from our website straight through, but the Tourist Board has the full documentation on their own website as well. So specifics, but really the real answer is just it depends how long it takes you to clean your surfaces, and that will depend.
Yeah, I can't give a quantifiable answer to that one, but I would just again say you got to go back and start the risk assessment, and you'll come to that.
I don't see any other questions have come through. Does anybody?
There was another one on the pre-submitted. There was a couple more. I'll just go through them. Are updates on regulations or guidance listed anywhere? We've already covered that at the start there. If you follow the links to the legislation, again, you'll find it there. Watch out for the amendments and make sure that it's the consolidated version, or you've got access to the amendments, which will always be listed with the legislation, okay? There was one about, legally, do we need to provide all staff with hand sanitizers? The short answer on that simple question is no. Legally, you don't need to give all your staff hand sanitizers. The long answer is you need to go to your risk assessment, and you identify hand washing and how you're going to control it. And a lot of people, you start with adequate hand washing and drying, and a lot of people then go on with additional controls, hand gels and things. That's why we're seeing a massive amount of it being used. There's no law that says you must hand all your staff hand washing or hand gel, but in my opinion, how else really adequately? What's the easiest way to do it? You know, they don't have to turn up with their own. Is that maybe a better way to answer it? Where are we now? There was a specific one about the driver training industry. Really, this one is actually falls under enforcement from the HSE NI, and it would require really specific replies. So I'm not going to answer that one. I would urge that.
Yeah, that was me. Sorry, Darren, that was me. Sent that one in.
Okay.
Unfortunately, everybody's passing the buck and being on to the agency, and they're passing me further down the line. So it's obviously a problem within the industry that needs longer term thought and planning.
Right.
So obviously it's a difficult question at this point in time.
Yeah, Mr. Henry, if you want to even look yourself, the Health and Safety Enforcing Authority Regs 1998, that's where you'll find that they are the authority for the peripatetic driving instructors.
Yeah, I think
if you continue to get nothing, try us, let us know. But that is a specific. It's in their remit, and they would have the expertise really to help you with that rather than local government.
Yeah, so I think
the problem I found is that they've sent me around in circles to various organisations who are sending me back to them, and it's frustrating as far as the industry is concerned. So it's a quest to find the proper information, because obviously it's a close contact business and we're meeting multiple people throughout the day, and it's about how to actually manage that risk as best as we can, with as much information as we can, but the appropriate people who need to be providing it, the guidance, are passing us on. So that's the problem.
Yeah, there is actually, there's a keeping workers and clients safe during COVID-19 in close contact services. There's a document.
Yeah.
I don't know if you can see that. And now it won't be specific to your industry, I wouldn't have thought, but along with the things we've discussed today and documents like that, you may be able to prepare for when you do reopen. So yeah, I would keep on it then, really.
Yeah, I think
I mean, anything we've discussed today, you can use to your advantage for when you do reopen, you know, so it's not hasn't been you being here anyway, you know, and certainly use away at those resources. But
it's certainly helpful.
Yeah. But I think the bottom line is you need to satisfy the HSE&I, not Ards and North Down Borough Council or any other council.
Yeah, and I think it's been challenging for you because, as you say, I'm aware that they've just keep passing the buck. Technically, DFI Roads Minister should be providing advice and guidance of when you can, but I believe they've been not doing that either. So, I mean, certainly, yeah.
No, they've basically washed their hands of the situation and put it back on us as an industry. And a number of driving instructors have gone back out of sheer desperation, but you know, I'm not prepared to do that until I've got a strategy in place that I'm completely satisfied with, that's going to cover my business and my customers as well. So it's still ongoing.
Okay, grand. Yeah. There's another question there, Andrew, just again, Sandy Cove. Busiest period coming up. The council enforcement officers contactable over the 12th holidays, but yes, we all. I'm assuming the answer to that is yes.
The answer is yes. We've got there's an out of hours and an on-call rota, so there's always somebody available. Yeah. So even if the offices are closed, there is an on-call. Whenever you phone at those times of the office being closed, you should get the instruction on how to then get put through for emergencies and things. And if that means bringing someone out from a health and safety point of view, that's fine.
I don't see any other questions, and I think all the ones that were sent in have been answered. Just to give anybody a last opportunity, but I say what we'll do now is we'll send you all out the presentation, which will have all the links and the links through to the documents and the risk registers and the tick lists, and hopefully you'll find that useful. And I'll just have a wee document to find out, you know, what is there other questions, or could we do that in advance? So certainly thank you for participating. We hope you find it useful, but if you have any follow-up questions or whatever, send them through and let us know. And as I say, we can always organise follow-up sessions, either one-to-one or another webinar, if you think that would be of use.
Yeah, so, thank you very much, everyone.
Yes, thank you. I really we wish you every success with your businesses and all of the challenges that COVID-19 has brought on top of that for you. So we really do wish you every success.
Good luck, guys. Thank you. Get in touch if you need us.